So students, let us now go to the next very important topic, that is the physiology of nose. Okay, so let us look at this image and what can we see? You see, during inspiration, what do you see? The flow of the air, you see, this is through the middle meatus in a parabolic curve, right? Okay, so most of the air is going through this middle meatus in a parabolic curve, right? What does that mean? We know over here, this is the olfactory fossa. This is the place at which we smell. Okay, our sense organ for smell is in this place, upper 1/3 of the nasal cavity, where we have the cribriform plate, and we have already talked earlier that the olfactory nerve fibers, they come from here and they form a olfactory fossa. Now, the maximum airflow is going through the middle meatus. It is not going in the superior meatus or in the sphenoethmoidal recess. So that means our sense of smell, human beings, our sense of smell is not very developed. If we have to smell, we have to sniff, right? So that we can have the air going up into the olfactory fossa. Let's look at expiration. Now, what happens during expiration? You see, during expiration, the air current which is coming out, this air current is re-rotated by these turbinates. By the Ansonite process, by the turbinates, they re-rotate them, and you see that now the air enters into the paranasal sinuses. Okay, so somebody asks you this question, when do the paranasal sinuses get aerated? Answer is during expiration, right? So getting aerated means the air enters into paranasal sinuses, right? The air enters into paranasal sinuses. We can see that is during this expiration. Okay, so you can say it like the paranasal sinuses are getting aerated. Okay, now when does the air comes out of the paranasal sinuses? Let's go back. Let's go back to this slide, and what do we see? We see that the air is flowing in a laminar flow. Okay, so you see the air is flowing in a very smooth laminar flow. Now, what happens? There is a phenomena that is known as Bernoulli's phenomena. So what is this Bernoulli's phenomena? Now, the Bernoulli's phenomena says that whenever there is a laminar flow, okay, it can be a flow of liquid, it can be a flow of solid or air. Okay, so whenever there is a laminar flow of mass, it creates a negative pressure around it, and that sucks the air out. Okay, let's take an example of an aeroplane. To understand this Bernoulli's phenomena, let's take the example of an aeroplane. So we know that the aeroplane is designed in this way. Okay, now it has a very special design. Why? You see, before taking off from the runway, the aeroplane has to achieve some speed on the runway. Okay, so it needs a runway to run on it so that it can fly up. So how does it flies? You see, when the airplane runs on this runway, now the air goes across the aeroplane. So you see, the air goes below the aeroplane and the air also goes from above the aeroplane, right? Now, there is some negative pressure created. You see, there is a relative motion between the aeroplane and the air. So there is a negative pressure created by this flow of the mass, right? Now, you see, the air current which is above the aeroplane has to travel a longer distance. So the speed is more. So therefore, the negative pressure produced is more. And therefore, after some particular speed of the aeroplane, this negative pressure will be so much that it will start lifting the plane up. So the plane will reach buoyancy and it will fly into the air. So we know now that this aeroplane flies with the help of Bernoulli's principle. The same principle is there when the train is coming on the platform. We are asked to stand behind the line because the train will suck us and it can hit us. Now the same principle also applies during inspiration. You see, the airflow through the nasal cavity, it creates a negative pressure. Now this negative pressure pulls the air out of the paranasal sinuses. Okay, so the air comes out, from paranasal sinuses, that is during inspiration. Okay, so what is the physiological importance of this statement? You see, when we breathe the air in, now this air mixes with the air that comes from the paranasal sinuses. So what happens? The temperature is adjusted. The moisture content is adjusted. Okay, so what are the paranasal sinuses doing? So what is the physiological benefit of these paranasal sinuses? They help, number one, in air conditioning. Okay, so they help us in air conditioning. So what do we mean by air conditioning? They adjust the temperature and the moisture content of the inhaled air, right? So before it reaches the lung, this temperature and moisture is adjusted as per what is needed by the body. Okay, now we saw the expiration. We saw how the air is coming back, rotating and going into these paranasal sinuses. So what happens? You see, the air which is coming out of the lungs, it is having a lot of heat and moisture. Now before it is allowed to go out, the turbinates re-rotate the air into the paranasal sinuses, and with that it drops the moisture, it drops the extra heat into the paranasal sinuses. This is saved so that it can be used in the next cycle of inspiration. Okay, so during expiration, these paranasal sinuses, they help us in preserving heat and moisture. Okay, so they help us in preserving the heat and moisture, do not allow it to escape the body. And then we can use the same heat and moisture for the next cycle of inspiration, right? Okay, now other than that, what is important over here is that this rotation of the airflow, this is known as eddy currents. Okay, and this eddy currents are mainly developed around middle turbinate. Okay, so this question has been asked in the exam. Where do we see the eddy currents? So remember, the eddy currents are seen around the middle turbinates and they are seen during expiration, okay, in the exhaled air. So these both statements are important. So remember, they are seen during expiration around the middle turbinate. So now let's come to the nasal mucosa. So we know that this nasal mucosa is the pseudo stratified ciliated columnar epithelium. Right? Okay, so now what is the function of these cilia over here? You see, this nasal mucosa, it has goblet cells. Now these goblet cells, they continuously produce mucus. Now the function of these cilia is that they beat together in a rhythmic way. Okay, so when they beat together in a rhythmic way, they transport all the mucus which is produced in the nasal cavity back into the pharynx, and from the pharynx through the esophagus it goes into the stomach. Right? Now this mucus is a line of defense. Okay, it has antibodies in it, it has other killer agents in it, and they all trap the bacteria, the viruses, all the infective particles, and then they engulf them in within themselves, and these are transported to the stomach where they are killed by the acid. Okay, now this flow of the mucus is known as mucociliary flow. okay, or you can call it as mucociliary clearance. So let's look over here. This is the mucociliary flow of the nasal mucosa. So you can see that these cilia, this is a very high electron microscopy image where you can see that these cilia, they're all beating in a rhythm, and this is how they are transporting all the mucus back to the pharynx. Okay, now this mucociliary flow can go up to 6 to 20 millimeters per minute. Okay, so that's the MCQ question. This is the speed of the flow of this mucocilia. Right, now let's look over here how this mucociliary flow moves. You see, this is the maxillary sinus, so the flow is towards the maxillary ostium. Okay, so you can see this flow, the flow once again, it is towards the maxillary ostium, and from there through the infundibulum, through the hiatus seminaris, it comes out and goes down to the floor of the nasal cavity. Okay, so that's the flow seen in the maxillary sinus. Now, how about frontal sinus? You see the frontal sinus flow, it goes through the central wall, through the intersinus septum, all across, and then it comes out through the lateral wall into the frontal recess. Okay, so we already discussed that this place over here is the frontal ostium, and this is the frontal recess. Okay, so you can see once again that the flow goes through the intersinus septum along with it, and it goes all around and then comes out through the lateral wall. Now, if there is an obstruction over here, as we discussed earlier in the previous topic of anatomy, if there is a cell over here, it may block and it may cause this flow to go back, and this flow may keep on rotating within the sinus, and there may be a collection of fluid inside the sinus. Right? Now, let's look at the nerve supply of the nose. The nerve supply of the nose, most important nerve supply that we know is the olfactory nerve. This is the first cranial nerve 1, and this is the shortest cranial nerve. It arises from the olfactory bulb. So we know that the olfactory bulb lies above the cribriform plate, and through the cribriform plate, these small nerve fibers, they come and they form an olfactory fossa, the organ of smell, in the upper 1/3 of the nasal cavity. Right? Okay, now other than that, we also have the anterior ethmoidal nerve. So you can see this anterior ethmoid nerve, and this anterior ethmoid nerve also gives a small branch known as external nasal branch of anterior ethmoid. Remember, we have earlier also talked about the anterior ethmoid block. So we give an anterior ethmoid block over here. So that is to block this external nasal branch of the anterior ethmoid. Right? Okay, so now other than these, we have some more nerves which are not that important, but for completion's sake, we'll quickly do them. Number 1, we have the posterior superior lateral nasal nerve. We also have the posterior inferior lateral nasal nerve. Okay, then we have the infraorbital nerve and the superior alveolar nerve. Okay, on the medial wall, on a septum, we also have the nasopalatine nerve. So this is the nerve supply of the nose, lateral wall as well as the medial wall, and this is the anterior ethmoidal nerve block. We have discussed it earlier also. Just to remind you once again that when we have to give an anterior ethmoidal block, so we are blocking this nerve, the external nasal branch of anterior ethmoidal, and this is the place on the lateral side of the bridge of the nose. We give this. This is used in rhinoplasty and some other external nasal surgery such as nasal bone fracture reduction. We commonly give this block. Right? Okay. Now, this area, the superior 1/3 of the nasal cavity, the septum as well as the lateral wall, the roof, this is the olfactory area. Right? This is the area where the olfactory nerve fibers, they pick up the sense of smell. So let's talk a little bit more about them. Now, we know that these olfactory nerve fibers, they arise from the olfactory bulb. Okay. Now, this olfactory bulb is connected through the olfactory tract, which take these sensations to the brain. Now, if you look at these, olfactory nerve fibers in high magnification, you will see that these olfactory nerve fibers, these are bipolar neurons. Okay, so look at them. These are bipolar neurons, right? And these bipolar neurons, they have two ends. One end is having the cilia, which is in the nasal cavity, and these cilia, they pick up the smell and they give it to the nerve cells, which is the receptor cell, which transport it to the brain, to the olfactory bulb, and then through the olfactory tract to the brain. Okay, let's study this olfactory pathway. Right? Now this olfactory pathway, it starts right from the olfactory cilia, which are in the olfactory mucus layer. Now these olfactory cilia, they transport it to the cells, the neurons, the olfactory neurons. Okay, and these olfactory neurons, further you can see over here, they go up through the cribriform plate into the olfactory bulb. In the olfactory bulb, they synapse. So you see, they synapse and they form a structure which is known as olfactory glomerulus. Okay, now from this olfactory glomerulus, we can see the efferent fibers which are coming out, and these go to the brain, and we also have the efferent fibers which come to the olfactory bulb. Right? Okay, now once again, we just saw these olfactory nerve fibers, we saw the olfactory bulb, and you can see that from this olfactory bulb, we have the olfactory tract. Now this olfactory tract, when it reaches the anterior perforated substance, okay, so this place is known as olfactory trigone. So when the olfactory tract reaches the anterior perforated substance, it divides into two parts. Which two parts? It divides into the medial olfactory stria and the lateral olfactory stria. Okay, now the lateral olfactory stria is the main olfactory bundle. Okay, now this is the main olfactory pathway, and this main olfactory pathway, the lateral olfactory stria, it goes and it relays in the pre-amygdaloid area. So this area over here, this is the pre-amygdaloid and pre-pyriform cortex, and we also call it as the primary olfactory cortex. Right? Okay, now this is the primary olfactory cortex. Now the medial olfactory stria, it perforates the anterior commissure, and then it goes to the contralateral olfactory bulb, and it gives an efferent supply to it. Okay, so this is the whole neural pathway of the olfaction. If you notice in this pathway, there are only two neurons. Okay, this whole pathway, it consists of just two neurons only. Right? Second thing, if you notice that this pathway, this is the only sensory pathway which is not relaying in thalamus. Okay, so it does not relay in thalamus, it directly goes to the cortex. Right? So it is directly reaching the sensory cortex without relaying in the thalamus. So this is important about this olfactory pathway. All right, now let's go ahead and let's look at the olfaction. So we just discussed the olfaction. And when I talked to you about this olfaction, I told you that the olfaction is orthonasal olfaction. So what do you mean by orthonasal olfaction? When we sense the smell, when we sense this odor in the inspired air, in the inhaled air. Okay, so as you can see in this diagram, so whatever we smell over here, this is in the inhaled air. This is known as orthonasal olfaction. But as I told you that during a normal tidal inspiration, the airflow is mainly through the middle meatus. Unless we inhale it, we sniff it with force, it is through the middle meatus in a parabolic curve. So this orthonasal olfaction nowadays we have found is not very important. Okay, what is important for us is the retronasal olfaction. Okay, now this retronasal olfaction, you see the air is coming out. So during expiration, the eddy currents are created. The air is re-rotated. Now this air goes into the olfactory fossa, and there the sense of smell is picked. Okay, now this olfaction, the retronasal olfaction, has nowadays gained a lot of importance. It is very important when you eat. When the food, the taste of the food is also adds to olfaction. How? You see, you put some food in the mouth. Now this food you swallow, you deglutate. Now what happens? It stimulates the cauda tympani nerve. This nerve is in the anterior 2/3 of the tongue where it supplies the taste. Okay. Now other than that, it also stimulates the lingual nerve. So lingual nerve is also in the anterior 2/3 where it is supplying the pain, the tactile touch sensation, the temperature. Okay. Then we have the GSPN nerve which is supplying the taste in the palate. Okay. And of course we have the 9th and the 10th cranial nerve which are in the posterior tongue and the throat. Now what happens? What happens? You see, we have the 7th cranial nerve here and here. Okay, and we have the 5th cranial nerve here, and we have the 9th and the 10th cranial nerves. Now all these nerves, they give a feedback stimulation to this olfactory pathway. Okay, so the olfactory pathway that we just discussed is also getting a feedback stimulation from all these nerves, and therefore these nerves, they also stimulate the olfactory cortex, and that is how it adds smell to the taste. Okay, so remember, not just the 1st cranial nerve, the 5th, 7th, 9th and 10th nerve are also involved in the olfactory pathway. Okay, and this question was asked in the AIMS November 2018 question, cranial nerve that is not involved in olfaction. Okay, so we just discussed that 1st is of course involved, but 1st you see was not even in the option. So we know that the 5th, 7th, 9th and 10th, these are involved. So we just studied. Now which is not involved? Hypoglossal nerve, the 12th cranial nerve. Okay, remember, hypoglossal nerve is a pure motor nerve. Okay, it's a pure motor nerve, so of course it cannot be involved in the sensory pathway, right? That is another hint. So answer is hypoglossal nerve. Okay, let's go to the next, the nasal cycle. So what is this nasal cycle? Now this nasal cycle is a physiological cycle. So first of all, understand, it is a physiological cycle. What happens in this physiological cycle? In this nasal physiological cycle, we have a time duration of 1.5 to 4 hours. Okay, so that's the average time duration. Now in this time duration, one nasal cavity undergoes congestion and one undergoes decongestion. Okay, so that means the nasal cavity which is decongested will be carrying more air. So when you inhale, more airflow will be through the decongested nasal cavity and less will be through the congested nasal cavity. And then after some time, this will reverse. So this is nature's way of putting one nasal cavity to rest and to work the other nasal cavity. Okay, so this is how this nasal cycle works. Okay, so it's an alternating cycle. One will have be decongestion, the other will have a congestion. All right, so at approximately 2 or 1.5 hours to 4 hours is this nasal cycle, right? Okay, now why this is important? This is important because sometimes we have a patient. Okay, now the patient comes to us and complains that I am having nasal obstruction. Okay, now what kind of obstruction it is? He will tell you that I am having alternating obstruction. Okay, between the two nasal cavities. What do you do when the patient comes to you with such a kind of complaint? you examine. Now on examination, what you found that both the nasal cavities are normal. Okay, there is as such no blockage, no obstruction, right? So what will advice will you do? You will have to just give the patient counseling. Why? You have to tell him about the physiological nasal cycle in which one nasal cavity may feel like obstructed, but after some time it opens up and the second one goes into congestion phase, right? Now this nasal cycle, in some individuals who are more sensitive, they feel it more, okay, so they will complain more, and some who are not sensitive that much will not feel such a nasal cycle, right? Okay. Now, to check for obstruction, we can do a lot of tests. What is the cause for this obstruction? We can do tests. So what test can we do? Number one is the Cottel's test. So remember Cottel's test we have discussed earlier also. This is a test to check the nasal wall collapse, okay? The internal nasal wall collapse. So what do we do in this? We keep two fingers on the cheek and then we pull them laterally. So if the nasal airway opens up, that means this was because of collapse of internal nasal wall. Okay, so this is a test for the internal nasal wall. Okay, now we have just seen the two tests, that is the cold spatula test and cotton wool test. Now, somebody asks you a question, which test is more physiological, which is better test? So if somebody asks you which test is more physiological, or in simple way somebody asks you which test is better test, okay? Now this is the question. So now you see the cold spatula test, this test only tests expiration. The mist formation is only during the expiration process. Whereas the cotton wool test, this tests both inspiration and expiration, right? So when you breathe in, the cotton wool goes in. When you breathe out, the cotton wool comes out, okay? So this is both checking both inspiration and expiration. So this is a more physiological test. Therefore, this is a better test, okay? So remember, the cotton wool test is a better test, or it is a more physiological test, right? Now, other than these tests, we have some newer equipment to check for nasal obstruction. Number one is the rhinomanometry. So in this rhinomanometry, we check the pressure and the airflow through the nasal cavity, okay? So what we are checking for? We're checking for the nasal resistance. How much pressure we have to give for this airflow, right? So we check for nasal resistance and we check for the speed of this nasal airflow. So how fast it can flow, right? So these are the two parameters that we can check with the help of rhinomanometry. So usually we do the rhinomanometry by blocking one side nasal cavity. So the patient puts a mask, and with this, with the pressure, the air is given, and on the end of the nasal cavity, with the help of a pressure probe, we check the airflow, the speed of the airflow, as well as the nasal resistance, okay, the pressure needed for this airflow. All right, so this is known as rhinomanometry. Now remember, this rhinomanometry provides us functional measure, how much the air is flowing. So functional measure of the airway resistance or the conductance of the airway. All right, now we have another method to check for the nasal obstruction, and that is known as acoustic rhinometry. Now this acoustic rhinometry, as you can see over here, this is a device which has a sound tube. Okay, as you can see from the word acoustic, we mean the sound. So what is given? Just like you remember the sonar, you give the sound waves, they reflect and come back. All right, and you can create a picture. So same way, you use a sound tube. This is kind of a sonar. You give sound impulse from the nose piece. You can see that this is the impulse generator. And what will happen with this? You can create the whole image of the nasal cavity. So when you are creating the image of the airway, that means you are checking the anatomy. All right. So this provides an anatomical measurement of the cross-section area or the nasal volume. Okay. So you are checking the anatomy over here. Easy to remember. Acoustic starts with A. It gives you the anatomy. Right. Rhinomanometry. Okay. So manometry, it's a physics thing. So that is a physiological measurement. Okay. That's a functional measurement of how much the air is able to flow. Right. So these are the two different new techniques which we can use to check for nasal obstruction.